In this video, I'm going to walk you through a CMS 1500 form, which is basically a standardized form that's used by healthcare providers for non-institutional providers, and this is used for Medicare and also for private payers. You would only utilize this form if you are billing for patients that are utilizing their insurance. Now, generally, you won't need to fill out a blank CMS 1500 form because most of the time, if you are using, let's say, an EMR, the information that's going to be on the CMS 1500 form is populated by the appointment information and the diagnoses and the information that is input for the patient. So like their address, their date of birth, all of that would be in the patient chart and populate on the CMS 1500 form. But you want to make sure that you know what you're looking at in the event that you need to make any edits. Also, if you're using a platform like Office Ally, for example, you can upload information to generate on a CMS 1500 form, but you can also just start from a blank CMS 1500 form as well. So again, you want to just make sure that you know what you're looking at. When I first started my practice, I was using Office Ally before I started using Simple Practice. And with Office Ally, I just had this blank CMS 1500 form, and I didn't know what information was the information that I needed to fill out because there's a lot of information that doesn't relate to dietetics on here. If you're utilizing a private payer website like Payer Portal for Independence Blue Cross or Availity for Aetna, for example, typically what you're going to do is be filling out different pages. If you're using a payer provider portal, like Independence has what's called Payer Provider, which is where you can submit insurance claims directly to Independence Blue Cross. And when you fill out the information, when you generate a claim, you're actually using a series of web pages to put in the information that generates then in a CMS 1500 form that would go to the insurance company. When you're utilizing like Office Ally or Simple Practice or another EMR, when you're utilizing those platforms, those are basically acting as a clearinghouse. So what they're doing is scrubbing your claims for any errors before they would go to the insurance company. In rare cases, you may also need to submit a hard copy of a CMS 1500 form, and sometimes they'll request mailed or faxed versions of this. This is not very typical, but it's something that can happen. And one thing that's important to note is that you can't just print off a black and white version of the CMS 1500 form. So you would actually need to order the CMS 1500 form from a vendor because there are specific guidelines as to the color. So this is like Flint OCR red, for example, and this is the only acceptable claim form would be those that are printed in this specific red ink. So I'm going to walk you through here how to fill out or know what you're looking at basically with a CMS 1500 form. So this top right section here, it says carrier. So this is generally where the information will be for the specific insurance company. So it'll be the insurance information and then also their payer ID. Now with an EMR like Simple Practice, that payer ID actually generates automatically with the CMS 1500 form. If you're using Office Ally, you would search for the payer and then the payer ID would generate for you. If you're filling this out from scratch, you would need to find the payer ID, which is sometimes on the back of the insurance card, or you would go to the provider section of the website for the insurance and find the payer ID that way. So items 1 through 13 are going to be patient and insured information. So item number 1, it says Medicare, Medicaid, TRICARE, Champ VA, Group Health Plan, FECA Black Lung, and then Other. So for Medicare, you would just check the box Medicare. Other would indicate any other health insurances like HMO, commercial insurance, workman's comp, automobile accident. Those would all fall under Other. So you would check whatever box this applies. So I'm going to choose actually the Other section here. So if let's say I was seeing a patient who had Independence Blue Cross, I would check off Other. The insurance ID number, so this is the ID that's on their card, and you want to make sure that you include any letters as well, followed by the numbers. So you would indicate that. The next piece of this you want to include would be the patient's name, their date of birth, their sex, and then the insured last name, which again might be the same as a patient or it might be their spouse. The patient address is number 5 here. The relationship to the insured, so is it the self, spouse, child, or other. And then 7 would be the insured address. So whether that is maybe different from the patient's. Now, sections 9 and 9A through D, this section you would only fill out if a patient had a secondary insurance plan. So you would indicate yes for is there another health plan benefit under here under 11D? So you would click yes, and then you would go over and fill in the information for that secondary insurance. 11 is the insured policy or FICA number, which is often not required, the insured's date of birth and their sex. And then 11C is the insurance plan name or the program name. Now, some payers use the plan name and others will use the ID of the insured individual. So for section 12, it says patient's or authorized person's signature. Now, if you are filling out a paper version of a CMS 1500 form, this is where either the patient would sign or you would indicate signature on file or SOF, or you would say no signature on file. Now, if you are utilizing an EMR, this actually generates with a checkbox and then it says signature on file or SOF. Number 13 here, it says insured or authorized person's signature. So again, you would indicate, or your EMR would have a checkbox and it would have signature on file or SOF. And this is basically that the patient is accepting that you are sending this information to be submitted for claims processing. So they're releasing medical information to process the actual claim. So it's basically allowing you to bill for the services that you have rendered. Now, items 14 through 33 are physician or supplier information. So this section in particular is where there's going to be some information that does not apply to dietetics. So like the current illness, pregnancy, other date, hospitalization dates, current occupation. So like 14, 15, 16, 18, none of those really apply to what you might be doing as a private practice dietitian. Now, what would be important is 17 and 17B. So 17, name of referring provider or other source. If you're, let's say, seeing a Medicare patient, it is required for you to have a referring physician, and you would need to indicate that on the claim. You would indicate the referring provider name and then NPI. So you would want to make sure that you obtain their NPI from either the practice, or you can also use the NPI registry to look up a NPI number as well. Under section 21, this is also an important field. So this is where you would indicate the ICD-10 codes. You don't have to fill out all of these sections here, so A through L. If you only have one ICD-10 code, you would just put that in under the A section. The period is actually implied, but you can still include that. It usually generates on like the EMR that I utilize. And then under here, resubmission code. So this is something that you don't need unless you are submitting a claim correction. So the resubmission code, if you are, let's say, submitting a claim correction, you would want to make sure that you have the original reference number, and then 7, which would be a replacement of a prior claim, or 8, which would be a void or cancellation of a prior claim. But again, you wouldn't indicate this as if this is the first claim you are submitting for a specific date of service. Now, under 24, you've got A through J here. So for A would be the date of service. So you're seeing a patient in private practice, it would be a single appointment on that day. So your from to date would be the same day. So let's say July 21st, 2023 to July 21st, 2023, because they're not staying overnight at your practice. B would be the place of service. So if you are seeing a patient in person in an office, you would use place of service 11. If you are seeing a patient through telehealth and they are in their home, it would be place of service 10. If they are outside of their home, so let's say they're at work or in their car, it would be place of service 02. And if, let's say, you're doing a home visit, you would use place of service 12. There's other place of services as well, but those are the most common ones that you might utilize. C does not have to relate to dietetics. D, so procedures, services, or supplies. So you have the CPT section here. So you would indicate 97802 if it was an initial session for one individual, 97803 if it was a follow-up session for an individual, 97804 if it's a group session, so 2 or more individuals as a group. The modifier, which is only necessary if you do you need to indicate a modifier. So if, let's say, you're doing telehealth, you would need to utilize modifier 95. Now, the diagnosis pointer, this was something that I got a little hung up on when I first saw these CMS 1500 forms. All this is pointing to the specific letter that's in 21. So diagnosis pointer, if you only have one ICD-10 code, you would only indicate A. So it's just pointing to the specific diagnosis code, so the ICD-10, that you would have indicated here. So this is what it would look like if you indicated the Z71.3 as the diagnosis, and then the pointer would be A, so you're pointing to that specific diagnosis that relates to this line item in terms of the service. And so I just indicated 97802 for the CPT, and the modifier 95 for place of service 10, which is again if the patient was in their own home. Now your charges, this is going to be your total charge for the appointment. Let's say you charge $100 for a session, you would indicate $100. You do not include your unit price here. This is the total charge. Next would be your units or days. So you're going to be billing by units. So if, let's say, if it was a 4-unit appointment, so it was 1 hour, you would indicate 4. The J section here, rendering provider ID. So this is the NPI of the individual dietitian. So that would be, you are providing the service as a dietitian, it would be your individual NPI. The next section of this form is 25, so federal tax ID number. So you would indicate that here and then check off that it was your tax ID, so your EIN. This patient account number, this is the medical record number, or MRN, if you have one. It's assigned by you as the provider otherwise. It is something that you can indicate, but it's not necessary. And then the accept assignment. So accepting assignment indicates that a provider is agreeing to accept the assignment under the terms of the payer agreement. So basically you are accepting your fee schedule, and you can't bill the patient beyond what is their financial responsibility, which would be indicated on the EOB. So that would be like if they have a copay or co-insurance, that would be indicated. But accepting assignment is that you are agreeing to the terms under your provider contract. The total charge here, so if you had a couple different line items, you had multiple services listed, you would total the charge for this entire submission. So it would be every line item here. The amount paid would only be if the patient paid you, let's say, a copay or co-insurance before the appointment. You would indicate that also on the claim form. The next section here, 31, so signature of physician or supplier, including degrees or credentials. So you as a dietitian would sign and indicate also your credentials and then date it. Now 32 and 33, so if the service facility location information, so if you're doing in person, you would need to indicate the service location, the billing provider information. For this section here, you would want to indicate your phone number, your information, so your address, your NPI, licenses as well would be in this section.